Hi, I'm Katie Dunlop. I'm the founder of Love Sweat Fitness, a women's fitness and lifestyle community. About 12 years ago, I went through a 45-pound weight loss transformation, and at that time, I felt really confident in a lot of ways, but I also lost my chest. I'd been about a full C most of my life, since elementary really, and it felt like a part of me had changed and was missing, so I had a breast augmentation done at that time. First surgery under the muscle, then had to do it over the muscle because I've been really active my whole life and they just didn't drop. Since then, I've been pretty happy with them, but there's definitely things that I wanted to improve upon. And this last year I had a baby, so I felt like it was the right time now, almost 10 years since my first surgery, to have everything revised. I'm gonna be doing a revision and a lollipop lift to really get that perfect chest that I've been looking for and wanting to feel my absolute best. So after doing my first surgery, when I had to do a second surgery a year later and put him over the muscle, I was obviously disappointed, and it's been kind of hard to think about doing surgery again. So I've taken a lot of time to do research and try to figure out who the right doctor is so that I can make sure I get it right this time. And I found Dr. Barrett and have been following him for a while, and I'm just so impressed by his approach to surgery. Really, the holistic, health-centered approach is something that aligns so much with what I believe in. Really just finding that healthy, balanced lifestyle. And the more I talked to him and got to know about the protocols he does prior to surgery to make sure like you're in optimal health, I just felt like that really resonated with me and was so much more than anything I found talking to any other doctor. So I'm super excited because I just feel very confident that this is going to be exactly what I've been looking for. I think in my industry especially, there's such an emphasis, as there should be, on self-love and being really happy with yourself where you're at, and I am. But I also think that doesn't mean you can't want to improve or change things. And so for me, I think it's really important to share that message of like, work really hard, do your best, take care of your body from the inside out, but you wanting to get surgery or feel your best in some way like that doesn't take away from the fact that you love yourself and you're really happy with yourself as well. I'm super excited today. I feel like over the last couple of weeks, I've gone through the wave of nervous, excited, but today I'm just excited because it's actually go time, and I know in a couple hours I'm gonna be feeling really, really good and excited to see how everything settles into place. So I'm just pumped to get in there.
All right, we're here with Katie today. We're going to do a great operation for her. So basically the goal is, you can see that she has a beautiful body, beautiful breasts. They are a little bit narrow, okay? So this happens sometimes with a higher profile implant. They tend to be narrow and more projected out, and her breasts have kind of dropped down a little bit. So our goal today is to swap it out with a more natural looking implant, a little bit wider base so that it fills in the cleavage there, upper pole fullness. All right, a lot of people forget moderate profile means it's a little bit wider. We're going to fill in that base up a little bit more, and then we're going to lift the whole breast up so that it is nice and perky with our lollipop lift.
All right, so we just did all of the markings and it's time to go back.
That's right.
For surgery.
Let's get ready.
I'm so excited.
Yes.
Let's do it.
You're gonna do great.
Thank you. It's 3 o'clock, I think. I was out of surgery at 10 or something. I haven't taken anything for pain yet. Well, I just took a little CBD. But Dr. Barrett and the team did have me on an IV drip post-op that's a bunch of amazing vitamins and stuff to help really eliminate any nausea and help me feel really good faster. So I honestly just feel tired. I'm not in a lot of pain at all. I'm just tired, and makes sense from anesthesia. So I'm just gonna rest. But I just wanna check in with you guys. About a week post-op, and I honestly haven't really had any pain. I have a little bit of itching kind of where the stitches are, but that's been about it. The healing has been really great, and even though I know they don't really look like they're gonna look at the end yet, I can already tell the fullness at the top is really, really good, and the closeness together is what I was wanting. So I know that in like the next few weeks and months, they're gonna look even better. So my experience with Dr. Barrett is night and day to my first plastic surgeon, even from the very first appointment, the thoroughness of him and his team, the details that they give you to make you feel super confident coming into the appointment. There was videos I could watch, like I knew exactly what to expect, and that really helped relieve all the anxiety and stress leading up to it. And then even the day of surgery, I don't know if it sounds weird, but like they made it feel like a fun experience and like something to really look forward to, and you felt like you were being taken care of from like family and friends versus just like an in and out of a doctor's office surgery kind of environment. My best advice I give anyone thinking about having a similar procedure is do your homework when it comes to your surgeon first and foremost. Obviously, I did a lot, and Dr. Barrett is the best, and now having gone through it with him, absolutely would recommend him to anyone. I think the most important thing is to really have someone that you trust, that you know has your best interest at heart, not only for the outcome of the looks of the procedure that you're having, but really, again, your whole body, to make sure your health is the #1 priority.
Everybody, Katie's here for her week 1 post-op, and we're gonna check on everything. We're gonna get stitches out, and we're gonna make sure that she is all set up for a speedy recovery. How you feeling?
Good, really good. Yeah.
Here we go. We're using an ABBA-TX, which is the latest pigment control laser on her scars. So a lot of times scars will get a little bit red. That's the healing that's happening. So we can decrease that redness by hitting it with a yellow light laser to pulse those lines away. And there's also another wavelength of the laser that we can do that actually improves the texture. It's kind of like a magic eraser on your scars. So if you're interested in this, check out ABBA-TX online, and you can learn about this laser.
It's been great. I mean, after the first couple of days, I didn't really experience any discomfort. I feel like it was more me having to constantly remind myself that I had had surgery, so to take it easy. So it's been a really smooth recovery. I feel like in the last couple weeks, everything's started to take shape. Like I thought it was a month ago, and now I'm starting to really see like where they're gonna settle, and I'm loving the shape and the size, and it's been great. I feel like definitely the pre and post surgery supplements and vitamins were such an important part of my full experience and being able to make sure my body was fully prepared and able to recover the best. The fish oil is something that I've always taken, but I think the ones that I got from here are way better. Like I actually felt so much better, less inflamed. I've noticed that like in the puffiness around my whole body. That's been great. And then the scar gel has been absolutely amazing. I've never had anyone kind of put as much care and attention into talking about the different things that can actually impact the scarring, as far as like the massaging, really specific scar treatment gels, and then doing the ADVA. So for me, just like everything that I've experienced working with Dr. Barrett, it's just been so thoughtful, and the multiple steps and different ways of like attacking every situation are something I've never had before, and I feel like is the best way to make sure that you're hitting things from all sides to get the absolute best results.
Everybody, we're here with Katie, and look at this beautiful cleavage, this new upper pole perkiness. You guys, if you remember, we did a pocket repair on the inside and we did our lift on the outside. This is truly a fantastic result for her. I love this shape and appearance that she has now compared to what she had previously. And we are, how far are we now?
4 months.
4 months, amazing. And she's got a couple more months to heal, so we're gonna work on some scar management, but otherwise, home run.
To do surgery, and they said honestly, and honestly I wouldn't be sitting here obviously if I didn't just completely trust you and love the entire process from the first consultation to like sitting here today. And I think one is you, because you are genuinely such a caring, thoughtful doctor, and like you go above and beyond, but also your team. And I know some of them are there with you today, but I think that also has made such a huge difference from the moment you walk into the office to all of those amazing people. Everyone on your team feels so genuinely like invested in the patients and making sure that their experience is comfortable and that we're well educated. Like I've never felt more educated about anything I'm doing. Again, I've had the surgery, similar one, different in some ways, but before, like never felt like I had the I feel like it's like a VIP concierge experience, like from start to finish with you guys, like every detail is thought of. So it was super easy, and I feel like it helped because I never had to really think about anything because you guys made sure I had all the information I needed from the very beginning.
Patient experience is number one. So I'm glad you had that experience.
Yeah, no, absolutely. And it shows that that's truly where all of your hearts are at. So some people say that and they put it up on the wall, but like you guys act that in everything you do. So
right.
Yes. To answer the question, for someone who wants to do a consultation with you, whether they live here or not, what's the easiest way to like start that process?
Yeah, I mean, if you go to my website, drdanielbarrett.com, there's a virtual consultation page, and you can just fill out some of your information, upload photos, and we kind of get back to you, kind of right away. It's awesome. It's an easy way for people that, especially because like late at night and nobody's here on the phone, we can get it started. Otherwise, you can just call us and you call the office. We have several specialists that are really well versed and can kind of help you figure out what procedure might be.
Yeah, perfect. One thing I appreciated so much also is that like at any point, any day, because I'm like hyper paranoid about every little thing with my body, when it comes to like healing and stuff, your team was so quick to get back. Like when emailing, calling, sending photos, everything, like getting advice and like action steps is always so great to know at like any moment I had that support team. And again, that's something I never experienced before, where like I felt like I actually had like people available to help talk me through things, to check things, especially not living like down the street, right? Like it's not so far, but it's not just easy to like try to pop in. So that was like really cool about the whole process with you guys too.
What really strikes me is how friendly and available surgeons are before you book your surgery, and then how that changes after you had your surgery, and we just get fired up when people are happy, right? And that process doesn't happen when we do the surgery, it happens afterwards. So it's just like, we don't front load our attention. If anything, we try to put it on the back end to make sure that you have access to us when you need us the most.
Cool.